This fall, Ohio voters will decide on Issue 1, a citizen-initiated amendment that would establish a state constitutional right to, quote, make and carry out one's own reproductive decisions. Today, we're going to hear the arguments for and against this measure. Welcome to Decision 2023, Ohio Decides in Issue 1 Forum. Thank you for being here. I'm Curtis Jackson. In partnership with the Ohio Debate Commission, the Columbus Dispatch, and the Cincinnati Enquirer, Spectrum News wants to give you, the voter, a way to learn more about State Issue 1 ahead of the November 7th election, while answering your questions about its impact. We have representatives from the campaigns for and against the issue who will make their case to the voters. But first, I'm joined by Jesse Balmer. Jesse covers state government and politics for the Columbus Dispatch and the Cincinnati Enquirer. Jesse, thank you for being here.
Thanks for having me.
Before we hear from both sides of this campaign, what can you tell us and what do voters need to understand about this amendment?
Yeah, so Ohio Issue 1 would enshrine access to abortion and other reproductive rights in the state constitution. The state could limit abortion after a point called viability, which is when a fetus can survive outside the uterus. It would be a decision made by doctors, but it's about 24 weeks gestation. Abortions could be performed after that point if it was necessary for the patient's health or to save the patient's life.
If passed, this amendment will go into effect 30 days after election, but some voters might be a little confused because we just voted on a State Issue 1, and it's the reverse vote this time. Before, there was the no campaign, and that people wanted to get passed, and then a yes, and now it's sort of the yes and then a no. It's a little confusing, but can you explain what this labeling is about?
Yeah, hopefully it's equally confusing for both sides, I suppose. But in August, Ohioans voted on Issue 1, which would have made it harder to amend the state constitution. And that was defeated. And each time we have a new election, there's a new numbering system for the constitutional amendments and the initiated statutes. So this abortion measure is Issue 1 on the November 7th ballot, and then Issue 2 would be about legalizing marijuana.
Abortion rights can be, and it's considered by some to be one of the more polarizing, if not the most polarizing issue right now on the political landscape. Give us a sense for how the state of Ohio is handling the abortion issue now. What is the law as it pertains to those rights?
Yeah, so on the day that the U.S. Supreme Court overturned Roe v. Wade, there was a law that took effect in Ohio, and that law prohibited many abortions in the state. Essentially, it said that doctors were not permitted to perform abortions after cardiac activity was detected, and that's about 6 weeks gestation. So that law was in effect for 82 days until it was put on hold by a Hamilton County judge. And that so currently the law in Ohio is abortions are legal up through 21 weeks and 6 days. But when that law was in effect, there was a dramatic reduction in the number of abortions, and some people went out of state to access them.
This all brings us to where we are today. The November State Issue 1 ballot initiative will need to pass with a 50% plus one margin. When it comes up for a vote, a no vote would keep Ohio's current law in place. Who are the major players here? Obviously, you've got the quote-unquote usual suspects when it comes to this issue in terms of just the people that are typically for and against abortion. But there's also, outside of Ohio, a lot of interest.
Yeah, so Ohio is actually the only state voting on abortion access this year. There were a number of states that passed it last year after the Roe v. Wade was overturned, and there's a number of states that are looking at it in the future. So really all eyes are on Ohio this year on this particular issue, but proponents are, people like Planned Parenthood, the American Civil Liberties Union of Ohio, and their kind of national affiliates, those longstanding reproductive rights groups. Opponents are people like your Right to Life groups. The Catholic Church has come out against this, and Susan B. Anthony Foundation nationally. So like you said, you're kind of usual suspects.
When you consider how important this entire issue is and the level of attention that Ohio is going to get nationally, that obviously sort of brings up the issue of money. How much money is going into these campaigns? What are we seeing?
Yeah, so there's really been millions of dollars spent on ads on both sides so far, and I imagine that's only going to ramp up as we get closer to the November 7th ballot, so it's going to be an expensive one here in Ohio.
Jesse, thank you very much. Let's give you a look at what's going to happen in terms of how you cast your vote and how this election is going to go. It started already, early voting, in-person voting started October 11th, and it goes through October 27th, open weekdays from 8 till 5. October 30th through November 3rd, open from 7:30 to 7:30 p.m. November 4th, open from 8 a.m. to 4 p.m. November 5th, open from 1 to 5 p.m. and military and overseas absentee voting begins on September 22nd and ends on November 7th. Absentee ballot voting by mail began on October 11th and ends on November 6th, and polls in Ohio on Election Day are open between the hours of 6:30 and 7:30 p.m. Voters can find their polling locations here at Ohio SOS, Secretary of State.gov, elections/voters, toolkit polling location. The Secretary of State's office says that we can expect to see the first results shortly after 7:30 p.m. on election night, and absentee ballots are the first, remember this, the first to get counted. Well, now that you have heard some of the background on the proposed amendment and how you can vote, let's switch gears to hear from both sides of the issue. Joining us now are representatives from the yes and no side of issue 1. For the yes campaign, Desiree Timms. She's president and CEO of Innovation Ohio. She hails from Dayton. She has deep roots in the community. You may have seen her on a ballot or two. She ran for Congress in 2020. And representing the no side is Mehek Cook. She's an attorney, small business owner, spokeswoman for Protect Women Ohio. She has also been on the ballot, having run for state representative in 2020. For the next 50 minutes, we're going to hear from them as they answer your questions and questions from two of the journalists who have been covering this issue this year. Let's take a look at our panelists. Joining us now, Tyler Buchanan and Karen Kassler. Tyler is a co-writer for the Axios Columbus newsletter covering news, politics, and culture in Central Ohio. And Karen Kassler is the bureau chief for the State House News Bureau and reporting daily for Ohio's public radio stations. Thank you, panelists, for being here. Karen, the first question is to you, and it is for both candidates.
Several people who submitted questions to the Ohio Debate Commission's portal asking for submissions were curious about parental consent and how parents' rights would be affected by the amendment. The Attorney General, Dave Yost, had issued a legal analysis. He asked his staff to come up with this. And that legal analysis said the amendment does not specifically address parental consent. And the amendment does not refer to women or pregnant women, but to individuals. And some are saying that that could open the door to include minors as well. So I want to ask you both, how can you explain how a yes vote or a no vote would specifically address parental consent?
And since the Yes campaign brought this ballot to the fore, you get the first opportunity to respond. You have 90 seconds in your response. You have 45 seconds for your rebuttal. Ms. Timms.
Well, I'm happy that this question was asked because there are so many confused voters out there because of the misinformation by the No campaign. The legal memo is in fact clear. There isn't any language that includes anything about children. In fact, children will still have to receive parental consent for any medical procedure. Issue 1 is about the extreme abortion ban that is currently on the books and our ability to make medical and healthcare decisions for ourselves and removing politicians from the process. That's what the Yes campaign is about, making sure people can decide what's best for their healthcare and not politicians in Columbus.
90 seconds, Mehek. Your response to this question.
So I'm glad that question was asked. We have to set the record straight today. Issue 1 is whether you're pro-choice, pro-life, or even somewhere in between, it is truly about protecting parental consent. Right now, the ACLU has written a very broad amendment. I urge every Ohioan to read it. If this was truly about abortion, they would have used the word woman instead of individual. They would have stated that there was an age limit to perform an abortion. They don't do that. They're taking away parental consent and notification. They're allowing for late-term abortions when a baby at 15 weeks can feel pain. And most importantly, there are health and safety standards on our books today for women. They eviscerate all of those. And all we have to do is look at the state up north. They have a similar amendment that was passed, and Gretchen Whitmer has basically said that today, every law on her books is unconstitutional, from parental consent to 24-hour waiting period to ambulatory care to even having somebody ask, a healthcare provider ask a woman, are you being abused at home? That is not acceptable. That is not what Ohioans want today.
45 seconds to rebut.
When I think about children in Ohio, I think about the 10-year-old girl who was raped and was forced to flee the state of Ohio to travel to Indiana in order to have an abortion. Because the extreme abortion ban that is currently on the books, there are no exceptions for rape, incest, or even the life of the mother. And no Ohioan should have to flee the state in order to access health care.
45 seconds to rebut.
So what happened to that young girl is horrific. But let me set the record straight. We have a 22-week ban today, and there are exceptions for the life of a mother. But what's most important is if issue 1 passes, then young women that are being trafficked, young women that are being raped will be able to go to a clinic without parental consent. It just happened with a soccer coach. A 14-year-old was raped by her soccer coach in Ohio. He pretended to be her father on the phone. More and more victims and predators will get away with rape. We have to protect the life of our innocent children and vote no on issue 1.
Let's go back to our panelists now. And Tyler, you've got the next question.
Hi, this is another question for both, and it also comes submitted by an Ohioan. The amendment text states that if this passes, abortion cannot be prohibited if a treating physician believes, quote, it is necessary to protect the pregnant patient's life or health. Jeff from Pataskala wants to know, what does the word health mean? Is this mental health, physical health, or could it even mean financial health?
Desiree, I'll let you start.
That's another great question. When we talk about healthcare, that's between the doctor and the patient. And politicians shouldn't be defining health, right? That's between the science and the physicians studying healthcare. Every doctor will tell you every pregnancy is different. And I trust doctors to make an assessment about their patient in terms of their healthcare. That is simply what this amendment is about. It's removing politicians from the process so that we can continue to access the healthcare we need without people in Columbus deciding what's best for us. Voting yes will ensure that the decisions made in the hospital room are between a doctor and their patient, and the doctor doesn't have to fear treating his or her patient because of what a politician might say or do in Columbus.
But heck, 90 seconds, how is health defined, you think?
I don't even have to think about this. It's what the Supreme Court has said today. They have held that health is financial, social, mental. So at the end of the day, the Supreme Court has already ruled on this. It is up to the doctor, the abortionist. They get to define what health is today, and that is unacceptable. And if you want to turn to science, as Desiree has pointed out, 15 weeks is what science tells us is when an unborn child feels pain. So anything after that must be prohibited. We have to look at the law and the facts today. It's absolutely important to have a doctor-patient relationship, but more important is to make sure that we have parental consent if there's a young girl going in, that we have the proper care and treatment for our families.
45 seconds rebuttal.
I'm happy that my friend here mentioned 15 weeks because the extreme abortion ban on the books is more like 6 weeks. And that's why people like Beth and Kyle had to travel out of state in order to access health care, because they had a wanted pregnancy and the organs were growing outside of the fetus. And the only way to continue was to have an abortion. And so they had to leave the state. This extreme abortion ban is not about 15 weeks, it's 6 weeks. In fact, amendments were offered in the State House to make sure it wasn't so extreme, and it was rejected every single time. And as a result, we have an abortion ban in Ohio that bans health care access at 6 weeks.
45, and then I do want to pick up on this one point that a lot of folks have been concerned about the lack of any exceptions. Your response?
So there are exceptions in our law today. I put aside the heartbeat bill, which has exceptions. I urge Ohioans to read that for the life of a mother. Today we have a 22 22-week ban. That is our law in Ohio. But that's not what we're talking about, Curtis. This amendment allows for full-term, late-term abortions, partial birth abortions. The ACLU had a pen on this, and I want to ask them, why didn't they define viability? Why didn't they use the word woman? Why didn't they say at 15 weeks or 22 weeks? I mean, you wrote this amendment. I think Ohioans deserve an answer. Why are we so extreme today? Why aren't we protecting, for an organization that's pro-woman, why aren't we protecting women and our children?
I want to give you 45 seconds to respond to that, because this has been a big question when it comes to this, and that is why there is no defined viability.
So the current language as written includes reasonable limitations after fetal viability. What we are concerned with is when patients enter into a hospital or a healthcare facility and they have a fetal abnormality or they have a personal healthcare challenge, that they can access the healthcare they need. The current law on the books says no. The current law in the books requires doctors to say, no, I'm sorry, I can't help you. They don't want to risk their medical license because they want to follow the law as written. And so this is an opportunity, and a yes vote is an opportunity to ensure that politicians aren't making that decision for families and for couples at such a personal and private moment.
Mahek, 45 minutes or seconds to respond before we move on to the next one.
We absolutely have protections in our law today for women. The fact that the ACLU is peddling misinformation about contraception, which is available in Ohio, miscarriage care, which is available. And I can tell you, I gave birth last year to my son, and in between, I thought I was having a miscarriage. I went to Riverside Hospital. They gave me the proper care, and thank God my son was born. But to peddle misinformation, you don't have to hear it from me. Go ask your doctor. Do I have contraceptive care? Do I have miscarriage care? We have to start telling the truth about this. We have to protect parental consent and children. We have to vote no, because our moral compass and our families are at stake today. This is too extreme and radical. Governor DeWine just launched an ad. He studied this amendment and said this is too radical for Ohio.
Let's go back to our panelists now. Karen, next question is to you.
Picking up on the statement about moral compass here, Sherry Hepner from Cleveland asks, is the viewpoint of those who will not be harmed by abortion more important than the viewpoint of those who probably or definitely will be harmed by the lack of complete control over their reproductive choices? Also, as an atheist, why must I be bound by the dictates of someone else's conscience? I wanted to ask that to Ms. Cook.
Well, thank you for the question. It's really important to know that this amendment is not about a woman's abortion specifically. It's broader than that. This amendment specifically is allowing for reproductive decisions. Again, the ACLU had an opportunity to define that. Reproductive decisions means cross-hormone therapy, transgender surgeries, painful surgeries that we don't want our children to go through today. And again, if you want control, then the ACLU should have written a ban, whether it's 15 weeks, 22 weeks. So it's not about what the moral compass is today. Everyone has a different moral compass for their family, but I urge Sherry and her family to sit down and have those tough conversations. We shouldn't have a radical amendment that allows for any of those decisions to happen outside parental notification, outside parental control, outside a thoughtful discussion that Ohio genuinely needs. We have in Dayton, Dr. Martin Haskell, who has performed thousands and thousands of partial birth abortions. He is the godfather of this. That is what we're trying to prevent. Congress prevented this by passing a law, and guess who the #1 donor in this issue is? It's Dr. Martin Haskell. He has a business plan because he wants to continue performing partial birth abortions. So I urge anybody to look at this amendment. This is not just about abortion. It's about much, much more. And if it was, they would have used the word woman. They would have defined viability. They did not.
All right, Desiree, 90 seconds.
Issue 1 is about ensuring that politicians are in the hospital room with you and your partner. And I'm happy you brought up Dayton, because there was also a patient in Dayton who had a wanted pregnancy. Unfortunately, she was diagnosed with cancer, and she needed to terminate in order to get the chemotherapy and radiation she needed to live. And because of that, because of this extreme abortion ban on the books, she had to leave. Can you imagine leaving home, extra expenses on top of the trauma and the heartache that you're dealing with because people in Columbus and the State House, whose names you don't know because you've never even voted for them, said you have to leave the state in order to access the health care you need because we have an extreme abortion ban on the books with no exceptions. No exceptions.
I want to give you a chance to rebut, but this does bring up a question here as it relates to representation, because as the Ohio Supreme Court has pointed out in previous rulings, there's a lot of aggressive gerrymandering here. So the people that are making the decisions in the State House are not necessarily entirely, at least, representative of where the rest of the state may be on this issue.
Well, I find it interesting that this Supreme Court once again asked both sides if they were okay with the maps that were presented in a bipartisan fashion, and the Democrat side said they had no objection. So as far as I know, for the next 8 years, we don't have gerrymandering.
But the supermajority was already in place, right? I mean, that, to be clear there, we're talking about a situation where you're talking about the most recent ruling. Prior to that, the maps that decided the last election were ruled unconstitutional. There's might be some people out there that may be concerned that their votes aren't being represented.
Well, I think votes are being represented today, and I think that every parent, every family should know that this amendment is truly about much more than abortion. It is much broader. The ACLU deliberately wrote a very broad amendment. You have the ACLU attorney specifically stating that they wrote an amendment because healthcare includes transgender surgeries. When asked, there's not a single person on the abortion industry side that will explain to us why they didn't use the word woman. So this is intentional. And I have to set the record straight. We have access. For anybody to say that women don't have access to contraception, miscarriages, or abortion at 22 weeks is flat out lying to Ohioans. And I think every Ohioan is smart enough to Google that. I think you Google what step can you have an abortion at? It says Ohioans at 22 weeks.
Desiree.
Anti-abortion advocates all across the country have introduced legislation that bans or restricts birth control, IVF. We've had legislators right here in Ohio who mention an interest, a fond interest, in banning birth control and miscarriage care. Issue 1 is about removing politicians from the process, period. It is about ensuring that when you are in the hospital and you need life-saving health care, or you are a survivor of rape or incest, that you can get the health care that you need. And you don't have to worry about a politician from the other side of the state who can interfere with that decision. That is simply what this is about. Women who get pregnant and have an opportunity to have autonomy over their body.
All right, let's go to our panelists for the next question. Tyler?
I want to continue the conversation about the wording of this amendment because a lot of the debate surrounds kind of the language here. This is a question for Ms. Timms. Attorney General Dave Yost had the legal analysis. He said the amendment text, in his words, quote, provides little in the way of definitions. And he says some terms, quote, have debatable meanings, rendering their interpretation much less certain going forward. Ms. Timms, do you agree or disagree with this assessment, and why?
Well, I think that's an opinion by the Attorney General, and the facts are the language is written in black and white, and anyone can visit readtheamendment.com and read it for yourself. The language is very clear. This amendment, issue 1, a yes vote, is about ensuring that politicians, regardless of their party or political affiliation, do not have a say when you are pregnant and you need life-saving care. They do not have a say when you and your partner are making very intimate, personal, and private decisions. The government should not be in that hospital bed with you. You, your family, and your doctor, that is it. A yes vote will ensure that that remains the way things should be. Unfortunately, right now, we have an extreme abortion ban law on the books at 6 weeks. You cannot access abortion care after that. If we do not pass this amendment, that will be the law of the land, and we will hear more stories about the 10-year-old girl, which the Attorney General and others said didn't exist, that she made the whole story up, will continue to appear. We'll hear more stories about the cancer patients. We will hear more stories about Beth and Kyle, who have a wanted pregnancy but have fetal abnormalities and they have to leave the state. We will hear more stories about working class people needing to leave to access the health care they need. So whether you are pro-life or pro-choice, if you believe in removing the government from those private personal moments, I encourage you to vote yes.
Heck, 90 seconds.
I 100% disagree. I think every Ohioan should know that the ACLU wrote this amendment. It was very deliberate. And let me read to you, every individual has a right to make its own reproductive decisions. They didn't write every woman. Individual means man, child, it could be anybody. Why didn't they use the word woman? They refused to answer that question. Reproductive decisions. What's a reproductive decision? It's something that impacts your reproduction. So it could be cross-hormone therapy, transgender surgeries, anything. And most importantly, it does not define when an abortion is permitted versus it's not. It specifically states, and I'll read to you, fetal viability, the point at which a pregnancy at professional judgment of a patient's treating physician, the fetus can survive. However, it's determined case by case. So now you're letting the abortionist decide when viability exists. This is extreme. It's allowing for late-term partial birth abortions. And by the way, the other side has not discounted this. They continue to come as we ask questions. Why didn't you define viability? Why are you for late-term abortions? The other side does not respond to this. If you vote no today, you're actually going to be protecting our women and children.
I want to go to Desiree. 45 seconds to be back.
You just heard the language for yourself. My friend read it to you. There are reasonable limits after fetal viability. Fetal viability should be determined by a physician, someone who's actually studied medicine, not someone who got voted into office at the State House. Fetal viability, that should not be determined by any politician on the State House floor. There are reasonable limits. The language is clear. I encourage you to also read it for yourself. Read theamendment.com. You can learn more about this amendment and why you should vote yes. If you believe politicians shouldn't be in that hospital room deciding and defining fetal viability and that should remain with doctors, then I encourage you to vote yes.
Mahek, I want to go to the statement that you made about transgender issues being involved in this. The Attorney General, David Yost, his analysis does not necessarily agree with that perspective. Having had no in law in place in Ohio that actually addresses this issue, why does this continue to come up, you think?
Well, he doesn't disagree either. He says that there will be litigation about this. Reproductive decisions should have been defined, but it wasn't. And we see across the country, state by state, that are targeting our young children. State of Washington, they just passed a law that allows for a child to go through life-altering, painful surgeries without parental involvement or notification. They get to stay at 6 weeks at a Safeway house. That is not what we want. Again, if we want to have these in-depth discussions about abortion, let's have them. But this amendment, it stops all of those discussions. This amendment allows for our children to be targeted. This amendment allows for late-term abortions, partial birth abortions. That's not where Ohioans are today. And it eviscerates our health and safety standards. Today on the books, if you're going through some traumatic reason for going through an abortion, you have to be affiliated with an ambulatory facility. We would get rid of that. God forbid there's an emergency. What does that woman do? 24-hour waiting period. When I go see my doctor today, because I am 7.5 months pregnant, they always keep me separate from my spouse and say, is there domestic abuse at home? Guess what? That won't exist anymore. Why are they so anti-woman? Why are they so anti-protecting what is so sacred today, which is our families and our youth? I don't understand it. They had every opportunity to write a clear amendment, and they didn't.
45 seconds to rebut, Desiree.
Yeah, well, I mean, she didn't answer the question because the answer to the question would be more misinformation. The reality is this language has nothing to do with trans children. I've already explained the law of the land is that any child trying to seek medical treatment or any procedure must have parental consent. In fact, what the language does say, it says that if you are a person who is pregnant, if you and your family, you're in that room and you need to decide the outcome of the procedure to save your life or the fetal the fetus is abnormal. That is a decision that can be made in the moment between you and your doctor.
All right. Let's go back to the panel. Karen, you've got the next question.
This question is for Ms. Timms. If Issue 1 passes, the ban on abortions after 6 weeks would be eliminated. That ban, of course, is currently on hold. But other protections would be created, such as the right to contraceptives and fertility treatments. These protections are not in state or federal law right now, and some might even call them new rights. So for those people who are looking at that part of the amendment and using that to make their decision, how can those be guaranteed and not left up to legal interpretation?
What this amendment will allow is it will allow us to ensure in writing and ingrained into our state constitution that we have the right to birth control, that we have the right to fertility treatments, and that we have the right to say and do what we need to over our bodies. That is what this amendment is about. A yes vote will ensure that Republicans or Democrats or whoever is in office can't take away your right to access birth control. They can't take away your right to access fertility treatments. I would not chance my rights with politicians because, as you know, control changes hands all the time. This is about ensuring that the control is in your hands and that you can do what you need to do in order to ensure that your health care is prioritized. Health care is personal. Health care is private. Healthcare should be a decision between you and your doctor and your family. No way should a politician come in and say, we're going to take away your birth control pills. We're going to take away IVF. It has been introduced in other state legislatures, and we are saying up front, it's a no for people in Ohio. And that's why everyone will vote yes in November, because they know these rights matter, and they're personal and they're private, and politicians have no business being in the room when you make that decision.
Mahek, 90 seconds.
We already have contraceptive care. We already have health care on the books today. In fact, just yesterday, the Ohio Department of Health director wrote a letter specifically stating this is misleading, this is false information. Doctors across Ohio have stated we have protections for health care. We have contraceptives, we have anything that a woman needs, including miscarriage treatment. So the other side is just peddling fear that is unnecessary. What this amendment truly is about is more than abortion. It is about eviscerating parental consent so that our children can go through abortions without your knowledge, your consent, your notification. It also takes care and completely destroys our healthcare standards for women. The legislature has spent decades ensuring that we have ambulatory care, that we have a 24-hour notification. All of these protections are to serve women. And this amendment allows for partial birth, full-term abortions. That's not where we are today. We don't want to allow for these abortions when a 15-week, which by science says the fetus, the unborn child can feel pain. We don't want to have those types of abortions in our state. And the record again is we do have abortion laws. We do have access. We have so many agencies across the country and even in our state today, 125 pregnancy centers that are offering birth control, ultrasound, any type of care and education to help those that don't feel that they have access.
45-second rebuttal.
I will tell you what's on the books. Republicans in the State House got together in a back room. Most of these people are often men, and they decided that they were going to ban abortion at 6 weeks. And once that legislation came together, many people stood up against them and said, hey, you know, there's this exception, and doctors advocated, and people testified, and every testimony and every amendment was rejected. And once that extreme abortion legislation passed through the State House, it landed on the governor's desk. And once it was on the governor's desk, he signed it into law. And after that, people in this state had to flee to access the health care that they needed. That's what happened, and that's what's on the books, a very extreme abortion ban right now.
Mahek.
So the heartbeat bill is on pause, but again, whether you're pro-life, pro-choice, or somewhere in between, I'm with you on this. This ballot language does not protect us. This ballot language allows for painful late-term abortions when a baby can feel pain, and science tells us that's 15 weeks. It doesn't allow for parental notification or consent. So your daughter can go get an abortion with their rapist. It happened. Remember the soccer coach that I shared with you? 14-year-old was forced to get an abortion so that rapist could cover his crime. And let's just talk about our health standards. We need to protect women. We need to ensure that our health and safety standards are on the books. This constitutional amendment will trump every state law. It will no longer exist. So we will have to lawyer up in Ohio to fight for our rights as women.
All right, let's go back to our panel. And Tyler, you've got the next question.
I want to look ahead beyond November. This is a question for Ms. Cook. Do you anticipate this vote will be the final say on abortion policy in Ohio? And if not, what would you like to see happen next?
Well, I truly believe that if issue 1 is a no and it prevails, then there needs to be some common sense discussions for pro-life, pro-choice, somewhere in between. We've had Governor DeWine even state that. He just had an ad come out that said he has studied this amendment. This is much more. It's radical, extreme. It goes further than Roe v. Wade. So we need to have those hard discussions. If this language passes, though, it closes the door on every single discussion, whether it's parental rights, whether it's common health and safety standards for our women, and it allows Dr. Martin Haskell, great godfather here in Dayton, Ohio, to continue his business plan, to continue to allow for partial birth abortions when a 15-week baby can feel pain. We have to fight against this. And the pro-life movement, the pro-choice movement, the somewhere in between movement, all agree we need common sense regulations, but to allow for abortions at this extreme state when a baby can feel pain, to eviscerate parental consent and not to have any protections, just look at the state up north in Michigan. It is already happening. It is not a hypothetical. They have gotten rid of every safety protection. They've gotten rid of common sense regulations. They're not even asking women. They're calling it unconstitutional if you want to ask a woman if she has been forced to have a child, if she has been raped. So just look at Gretchen Whitmer. That's not the type of Ohio that I want to see and that Ohioans want.
Thank you. Desiree, is this the final word?
Well, for the yes side, I hope it is. I hope we have a win and that people have an opportunity to decide what's best for them in their health care. I'm focused on the Buckeye state here. This is about ensuring that every Buckeye can stay in the state and access the health care that they need without fleeing to another state. We see this a lot with prescription drugs. A lot of Americans flee to Canada because they can afford it. That shouldn't happen. That shouldn't be the case. You should be able to contact your doctor down the street and they provide the health care that you need. So more than 700,000 Ohioans signed the petition so that we can get this on the ballot because they understood how extreme the abortion ban was that was passed into law, and that a 6-week ban with no exceptions for rape, incest, or even the life of the mother was too extreme for Ohio.
Heck, your rebuttal.
Our laws on our book today specifically state that there are exceptions for the life of a mother, and peddling this type of fear and misinformation is just not acceptable. We have protections for women today on our books. The reason that this was even on the ballot is because the ACLU spent millions of dollars misleading Ohioans, scaring Ohioans through fear tactics, and ensuring that they put ads out there that said, we're going to get rid of contraception, we're going to get rid of miscarriage care. It's not protected. The Department of Health director has said we're protected. The Attorney General has an opinion out there. Anybody who reads this amendment can tell you today, this is far more than just abortion. This is about partial birth abortions. This is about eviscerating parental consent.
I'm going to ask a question here on my own and start with you, and then I'll come to you with a variation of it. But we got here largely because of the Dobbs decision, right? Before that, we had strict scrutiny in place under Roe, right? And then we had undue burden under place under Casey. Both of these things were eviscerated with that Dobbs decision. And essentially, the court is saying the public should decide. If the people of Ohio decide that this is where they want to go, and that's following the court's order, is it not?
I know that the people of Ohio definitely, and women will say this to you, 60% of Americans want some type of access to abortion. But this isn't 60% of Americans speaking here. This is the ACLU spending millions of dollars to allow for partial birth abortions, which would occur at 15 weeks or after. And that is not acceptable. And the fear and the lies and the peddling of information, that's misinformation on the ACLU side. And I continue to ask, why wasn't there the word woman? Why didn't you define reproductive rights to 15 weeks, 22 weeks? Why? I mean, they had the pen on this. You had the ACLU attorney stating parental notification is a burden. We want to allow for all health care, including transgender surgeries. I mean, where is he now? Nobody will answer my question. Ohioans deserve to know. Why doesn't this say women? Why doesn't it define viability? And if this was not about our children and about parents, adults, then why doesn't it have some type of age limit? I'll tell you, the ACLU drafted a similar amendment in Florida, Curtis. They went back and they revised it and said, you may require parental consent if the legislature passes a law, because they knew not to mess with parents when it comes to our children.
I'm going to pose a similar question in terms of just a small argument from the other side here. And it's this. If you look at this issue internationally, if you look at it in places like Germany and around the world, they have had these debates long before, or right around the time as Roe, in which they decided, okay, what is going to work best, for us as a country? Is that something that's missing here? Does there need to be more conversation and more opportunity for people to weigh in and say, look, we think viability should be this, or we think these things should not occur under these circumstances?
One of the things that makes America so amazing is that we have choice and we have a say in our democracy. What this amendment is about allowing people to decide what's best for their bodies. When we saw, you asked about Dobbs v. Jackson, right after Dobbs occurred, the supermajority in this state moved to enforce an extreme 6-week ban. As a response to that ban, more than 700,000 people signed a petition. More than 4,000 doctors in this state organized to say this is too extreme for Ohio. I can't do my job as a physician. What this is about is ensuring that every Ohioan can make a decision for themselves, removing the government and politicians out of that. And I think that's what makes our country and our state different from other countries. The people here have a say.
Rebuttal?
So thank you for saying that, Desiree, finally on the record. Every individual can make a decision about their bodies. Great, but now you're just admitting that you are allowing for partial birth abortion. There needs to be a limit on that. There needs to be, and science has told us 15 weeks. So I want to tell Ohioans today and make sure that they know it's not 6-week or partial birth abortions. These are false. We shouldn't be trapped into this. We should talk about what this amendment does, which is eviscerate parental rights, takes away the ability for us to protect the life of an unborn by allowing for partial birth abortions. And once we defeat this by saying no to issue 1, because it goes further than Roe, let's get back to a discussion, a common sense discussion about where we go. But it can't be one or the other. Both extremes don't work in our state. We agree to that. But to say that it allows the individual to decide, you just made my point.
I'm going to go back to our panel. Tyler?
When it comes to this abortion debate, it's obviously very controversial, and I want to ask both of you, what's something that you wish that the other side better understood or appreciated about your side's position?
Desiree, we'll start with you.
I hope the other side would appreciate that the current law on the books is a 6-week extreme abortion ban with no exceptions for rape, incest, or the life of the mother. I want the other side to understand what it's like for that cancer patient who has a wanted pregnancy and now has to flee the state of Ohio in order to access life-saving health care. I want the other side to understand what it's like to have the jelly rubbed on your belly, to have that ultrasound, and to find out that there is a fetus abnormality, right? I want the other side to understand the pain that people are going through. And then imagine a politician walking into that hospital room and saying, I get to make that decision for you. That's not right. This is about ensuring that in those moments of personal time, private with your family, that you can decide, you, your doctor, your spouse, what's best for you, and not the politician down the street or from the other side of the state who you don't know because you've never voted for them. They don't get a say. in what's best for you and your life and your health care and your family. That's what I want the other side to understand.
Heck, what do you want the other side to understand?
I just want the other side to be honest with Ohioans. I want the other side to admit that they used the word individual when they had the pen and could have said woman. I want the other side to understand when they use the word reproductive rights, it means any type of surgery. It allows for an individual, which could be a child, it could be a young girl, to go through life-altering, painful surgeries without parental consent. And I want the other side to understand that you may not agree with what the law is today, which, by the way, is 22 weeks with exceptions. Let's have that discussion. But this amendment does not allow for any exceptions. This amendment specifically says one can make its own reproductive decisions, including continuing its own pregnancy. It leaves the decision to the abortionist, people like Dr. Martin Haskell, who get to decide if at 15 weeks or greater, a child can be aborted. That is not where Ohioans are today. That is extreme. Let's get back to common sense. Let's work with our legislators. Let's work with our governor, who has been on the record to say he has studied this, and this is too radical. It goes further than Roe v. Wade.
I'll give you 45 seconds.
Yeah, you hear the other side talk about 15 weeks, 20 weeks, 22 weeks. This is not a lottery ticket. The law on the books says that 6 weeks is the law of the land. Abortion is banned at 6 weeks. If you fail to vote yes, that will continue to be the law of the land. It is so important that every single Ohioan votes yes to ensure that we can push back against that law, that we can push back and say we deserve to make the best healthcare decisions for ourselves, not the politicians, not the other side. This is about ensuring that healthcare remains private, personal to you, your family, and your doctor, period.
You shook your head there. I'm going to give you 45 seconds.
The state of Ohio law, and you don't have to be an attorney, you can Google this. It's 22 weeks for abortion access today. So let's set the record straight. Let's stop the fear mongering. Let's make sure that Ohioans know it is 22 weeks today. We need to stop stating a 6-week ban or a 10-week ban. It's 22 weeks. My point today is we're looking at science, so let's talk about science. At 15 weeks, a child can feel pain. Let me tell you, the Guttmacher Institute, 60,000 babies are aborted yearly, not because of the health of the mother, not because of the child, because it's an elective decision. That's not where Ohio is. Let's get back to common sense. Let's protect lives. Let's protect parental consent. Let's protect women, basic health and safety standards.
Karen, I want to go back to you, and I think this might be getting closer to the last question.
And this question is for both of our guests. This ballot also features another big issue, a law legalizing recreational marijuana. Issue 2 is expected to bring out younger voters and those who might not have voted in a while. And there are no statewide candidates on this ballot to drive the conversation or to take attention away from these issues. So I'm wondering, have you factored in the possible impact of issue 2?
Desiree.
We've certainly considered the impact of more people voting this upcoming election, which we encourage because it's a democracy. We want more people to vote, and we hope that more people will exercise their right to say yes to issue 1, because this is about ensuring that every single person can access the health care that they need. And I think the more people who have an opportunity to get into that ballot booth and read the language for themselves and say, you know what, I deserve to make my own health care decisions. I deserve to ensure that I have access to birth control. I deserve to access miscarriage health care. I deserve to make that decision, not the politicians. So yeah, I think I'll vote yes. And I'm excited about that fact that more people will be in the booth voting yes this November.
Is issue 2 a factor, you think, that could determine the fate of issue 1?
I think we're going to have more voters, and it's so important. Our campaign on the no side has worked with pro-choice, pro-life, somewhere in between. We had over 100 faith-based Black pastors across the state of Ohio that said this was a life and death situation, that we must vote no on issue 1. So the more voters that come in and vote, the more we're going to hear Ohio voices. But at the end of the day, we have to go back to what issue 1 truly is. It is putting our women at risk if we don't vote no, because we will get rid of all of our common sense health and safety standards. It will allow for partial birth abortions when a baby can feel pain. That is not where Ohio wants to be today, and it eviscerates parental rights. The ACLU has decades and decades of time spent from Alaska to Indiana where they are attacking parental rights. They're calling parents like me and Ohioans a burden. When did we become a burden on our children? We are here to protect our children. And the Ohio I know is not radical. It's not extreme. And the governor agrees. He has said this is very radical. It goes above and beyond even Roe v. Wade. That is not where we need to be in our state.
45 seconds.
I'm a person of faith, and I'm also a person of statistics and numbers. We know right now that Black women are 3 times to 5 times more likely to die in childbirth. What we don't want is for a doctor in the middle of delivery or in the middle of assessing a pregnancy to say, you know what, I have to confer with the politician down the street to decide what I should do next. In fact, we want to make sure that doctors and people in the delivery room, in the hospital room, can decide what's best for the patient so that they can provide the highest standard of care for the patient in that moment. A yes vote will ensure that you, the patient, you, the family member, can decide what's best for your health care without conferring with politicians in the State House.
45-second rebuttal.
We have to be clear and follow science today. A baby feels pain at 15 weeks. That is a standard that no doctor has pushed back on. What the other side is pushing for is partial birth abortions, which should not be allowed. And let's talk about the Black community. 13% of Ohioans are our Black community. Out of that, do you know how many abortions occur? 48% in our Black community. We need to make sure that we are continuing to provide services. We're continuing to provide information. We're continuing to provide support. The governor has doubled funding with this General Assembly to help pregnancy centers, to help crisis centers. To sit here and talk about statistics, we need to make sure that we're reaching those common sense solutions so that we are protecting Ohioans and we're protecting the life of an unborn, that we're protecting our children so that a predator can't take that poor child in, the soccer coach, for an abortion without parental consent. It's unacceptable.
I think we got one more time for one more rebuttal.
Well, I will just say the stats don't lie. Black women are dying on the table. The stats don't lie about the healthcare disparities that exist not just in Ohio but around the country. Either way, we don't want a doctor in the middle of a crisis, a medical crisis, to say, I have to confer with a politician because I need to follow the law before I decide what's best for my patient, before I decide to save my patient's life. If you care about your doctor making the best decision for you, your family, and your neighbors, you will vote yes because you understand how terrible that is for a doctor to pause and think about what the politicians might have to say about their life-saving treatment.
Okay, we have reached the point now for closing statements, and since the Yes campaign has brought this to the ballot, you get to go first. 90 seconds.
I encourage every Ohioan to vote yes this November because this is about ensuring that every person has a say over their body. This is about ensuring that when you're in the hospital room, when you're in the delivery room, when you're in a moment that is very personal and private, that you get to make the best decision for you. I want every voter to think about Beth and Kyle, who had a wanted pregnancy, but unfortunately the organs were growing outside of the fetus. And they could not access the health care they needed right here in Columbus. Instead, they had to travel out of state to get the health care they need. I want every voter to imagine the cancer patient excited about a pregnancy and then learning that she has a diagnosis of cancer. Cancer in and of itself is traumatizing, and then needing to terminate. But no, you can't terminate right here in Ohio. You have to leave the state. If you care about common sense laws, removing the government out of your personal and private business, you will vote yes this November. A yes vote will ensure that the extreme abortion ban that bans abortion at 6 weeks will not go back into effect, because that is what the other side is not saying. As soon as this election is over, that will determine the fate of the laws in this state. Every Ohioan has a say over her health care, and the politicians in Columbus have no right to interfere with that decision.
Thank you very much, Ms. Timms. And now to you, Mehek, your 90-second closing.
I'm really disheartened to hear a lot of the misinformation that is being spread today. I think that every single Ohioan should know that this is the most extreme amendment that could go into effect if this is passed. We must vote no on issue 1 so we can protect parental consent. It's very important. We had the example of a soccer coach that forced his 14-year-old rape victim to go get an abortion without parental consent, just by pretending to be a parent. That cannot stand in our state today. Protecting the life of an unborn. This allows for abortion past viability. This allows for the abortionist to determine when to terminate a pregnancy. And at 15 weeks, when a fetus can feel pain, that is not acceptable. That's not where Ohio wants to be. And the other side continues to state that we have an extreme law in the books. The last time I checked, it's 22 weeks. I urge every Ohioan to look at that. And all you have to do, this isn't a hypothetical, look at the state up north. Look at what Michigan has done. They passed a similar amendment, and now they've gotten rid of all of our protections for women. They're on the chopping block. Parental rights are now considered a burden. You can't even talk to your doctor to say, I'm in an abusive situation. Doctors aren't going to ask you those questions. This is not the solution for where we need to be when we talk about common sense. This is eviscerating, and it will also cement partial birth abortions and allow the Godfather, Dr. Martin Haskell, give $100,000 to this campaign to continue.
Thank you very much to both of you for taking the time to make sure that your views get represented and the public gets their opportunity to hear from both sides and make their own decision. Once again, thank you to our journalists, Jesse Baumert and Tyler Buchanan, also Karen Kassler, as well as the representatives for the respective campaigns, Mehek Cook and Desiree Timms. This program was made possible by the following organizations: the Char and Chuck Fowler Family Foundation, the George Gunn Foundation, and the Tecovas Foundation. This forum was made with the Ohio Debate Commission in partnership with Spectrum News 1, the Columbus Dispatch, and the Cincinnati Enquirer. Be sure to get out and vote for the November 7th election. This is your choice to make. Thank you for joining us. Have a good day.